Hello, everybody. My name is Graham Elwood, and you are watching the Political Vigilante. Check it out. This is the People's Channel, folks. Thank you so much for supporting what we're doing. Our super chats are back. You can be a YouTube member, subscriber, all this stuff, and you're supporting the show. And then, of course, you can do super chats during our live streams. We typically go live Monday, Tuesday, and Wednesday at 5 o'clock Pacific, 8 o'clock Eastern. And then periodically on Thursday or Friday, we might go live earlier in the day at 10 or 11 Pacific when I'm walking the SAG picket line. And why I bring up the SAG picket line is because we interviewed on the SAG picket line, if you haven't, go check the video, of some nurses, from people from the nurses union were walking in solidarity this summer with the writers and the actors. Now the WGA has reached a tentative agreement, so that deal should be done soon. And the AMPTP has started negotiating as of Monday, October 2nd with SAG-AFTRA. So I feel like a deal is imminent with the actors as well. It doesn't make sense that the producers would make a deal with the writers and not the actors. But I bring this up because we've talked a lot on this show for years, but especially this summer. It's hot strike summer. We've got the UAW now is on strike, the auto workers union. And now, people might not know this. This was just in The Guardian today. There's 75,000 healthcare workers are about to go on strike. This is a big deal. Over 75,000 workers poised for largest healthcare strike in U.S. history. Kaiser Permanente workers push for improvements to staffing levels and wage increases after union contract expires. So this is significant. And, and this is what, if you go back and watch, please watch all my interviews from the SAG WGA picket line, because I speak to a couple of healthcare workers and they were telling me this from the picket line this summer, and hats off to them for marching in solidarity with us. And it was really cool. But so this article is just basically confirming what they told me on the picket line over the summer. More than 75,000 healthcare workers at the U.S. largest nonprofit private healthcare provider, Kaiser Permanente, are poised to strike on October 4, which is tomorrow. Today is Tuesday, October 3rd, in the largest healthcare strike in history. The workers' union contract expired at the weekend, and staff are pushing for significant improvements to staffing levels and wage increases that account for recent high inflation. It just seems like there is no concern for short staffing and patient care. It's mind-blowing to see Kaiser Permanente, that was once an industry leader that liked to call themselves the gold standard of care, be so out of touch with employees, with their patients, and they're more focused on putting profits over patient care. This is the problem of having a for-profit healthcare system. Healthcare should never be for profit. It should be about the patients. Healthcare is a human right. Or as Bernie Sanders would do it with the silent H, a human right, a human right. It's, and this is another, the strike will hit hundreds of facilities in California, Oregon. I'm a Kaiser member. I have Obamacare through Kaiser, so this is going to affect me. But I stand in solidarity with them. The coalition of Kaiser Permanente unions noted that if they don't see movement at the bargaining table in response to the strike, another longer strike that includes additional workers in Washington will be called. And this is significant, this quote right here. They always praised us as healthcare heroes during the pandemic, and now they're treating us like zeros by not bargaining in good faith. Yeah, remember when everyone was banging their pots and pans at 8 o'clock every night? Well, now they're not getting what they need. He explained that working in an emergency care unit, there are days where he has to do the work of 2, 3, or 4 other unit assistants, and short staffing has led to patients having long waits for assistance, which poses a significant safety issue for them, and claim the problem has only worsened due to the COVID-19 pandemic. On top of having my unit, I will have the entire hospital, which is 102 patients I'm responsible for, and it causes burnout. It causes mental anguish. It causes stress. I see my nurses I support, and we're constantly running on fumes because of staffing. Well, there's been a nurses shortage because they got worked to the bone during COVID, and they weren't even rewarded now. Kaiser Permanente serves 1.2 million members in California. I'm one of them. The Political Vigilante is one of them. Washington, Oregon, Georgia, Hawaii, Washington, D.C., Maryland, and Virginia. The nonprofit has reported more than $3 billion in profits. Gee, how do you have $3 billion in profit if you're a nonprofit? In the first half of 2023, and has paid at least 49 corporate executives salaries exceeding $1 million annually. Oh, of course. A patient access representative at Kaiser Permanente Sunnyside Medical Center in Clackamas, Oregon for 14 years said that prior to COVID-19 pandemic, his department was staffed with about 60 employees and now has been operating with less than 40 after cuts to the department. How do you cut people during a pandemic? Which has resulted in long lines and delays for patients trying to check into their appointments. It's really taken a toll in the hospital setting and in the medical offices that we have here, said Darden. That's what we're fighting for. Our frontline employees are demanding Kaiser Permanente executives come to the table. We've proposed the things that would fix the staffing issue. We've made tons of proposals, but because our executives just aren't listening to us, they are just not coming to the table to even entertain those proposals. Jeff Malaria, a teleservice representative for Kaiser in Sacramento, California, argued that Kaiser has been growing in membership, but hasn't kept up staffing levels to handle it. We want our patients to be safe. And we want them to get the best care that they need. Said Malaria. No one wants to strike, but we have to stand in solidarity because the executives are making millions of dollars. How are their executives making millions of dollars in healthcare? This is such a problem. No one should be making millions of dollars, but this is when you have a for-profit healthcare system, the patient is just seen as a customer. And, this is the problem with capitalism. It's so awful. Oh. Kaiser Permanente was said, despite the acute shortage of healthcare workers nationally, we have been able to hire more than 50,000 frontline employees in the last 2 years, 29,000 people in 2022, and another 22,000 so far this year. Included in this year's new hires are more than 9,800 people hired into jobs represented by the coalition. They also noted they are continuing to bargain with the coalition to avert a strike, but have contingency plans in place to continue providing care during the strike. Wow. Once again, it's the same story in healthcare, executives making millions and billions of dollars, employees not getting up. It's the same thing that the UAW is facing. It's the same thing that writers and actors are facing. It's the same thing the Amazon workers are facing. It's the same thing across the board. These awful systems where a handful of people make all of the money and the employees get screwed over, the patients or customers get screwed over. I mean, that's why we all have to stand with all of these labor strikes, because it's going to affect all of us. And if healthcare workers go on strike, they're essential. Why do we need healthcare executives? What do they do? Any healthcare executives saved a life? What do they do? When the pandemic hit, were we all like, oh my God, I hope there's enough healthcare executives? No, we were all like, I hope the nurses and doctors are safe. I hope they're okay. I hope they can perform their jobs. And our hearts went out to anybody that did that. And they got burned out. A lot of people didn't. A lot of nurses quit. A lot of doctors quit. But the CEOs made record profits. So sick of that story, man. Don't tell me how great don't tell me capitalism has pulled people out of poverty. That's been completely debunked. This isn't good. Healthcare workers shouldn't go on strike. And more importantly, there shouldn't be executives getting 7-figure salaries and bonuses or 8 figures. It's preposterous. You run a hospital, you should get maybe 150, 200 grand a year, maybe 250, maybe at the most 300. If you're a good physician, all right, you make 200 grand a year as a surgeon, a hearts, whatever, but you shouldn't be making 7-figure money. Oh, we need free healthcare in this country. They've had it in Western Europe since the 40s. It's nuts. Medicare for all. We're big proponents of it on this show. Follow the money, connect the dots, get the truth. And that's how we make Gotham great again, folks. Go to GrahamElwood.com. I will be at the Adopting Bitcoin Conference, November 7th through the 9th in El Salvador. November 8th, we are doing the Bitcoin Hollywood Comedy Show. So you can get your tickets. Go to GrahamElwood.com. And if you use coupon code Elwood21, you save 21% off your Adopting Bitcoin Conference 3-day pass. Thanks for watching, everybody. Shave your knuckles for justice. Boom.